Hello, welcome back. I'm Dr. Elizabeth Wick, facial plastics and hair surgeon. Today we're going to be talking about the basics of Botox. So if you're a patient that's thinking about getting your first treatment, whether it's you're 25 and want to start prevention of fine lines and wrinkles, or if you're 65 and you want to know more about what your daughter or grandson are getting into, you're in the right place. So the first thing I like to talk about is what are the different types of neuromodulators. So you've got the most common are Botox, Dysport, Xeomin, Jeuveau, and the most recent one is called Daxxify. This one's a little different because it's going to give you up to 2 times the duration that you might get with the other ones. So all neuromodulators work by temporarily blocking the action of the facial mimetic muscles to prevent the contribution in the formation of fine lines and wrinkles. For instance, the forehead has a muscle called the frontalis, which pulls the brow up, but also kind of creates these fine lines and wrinkles of the forehead. The other popular area for treatment is the orbicularis oculi, where we try to prevent those crow's feet. And then you have the corrugators in the glabellar region, or the area just above your nose. There's some other muscles in that area as well. But the idea is that these are the main targets for this muscle treatment. Neuromodulators are temporary, so the majority of patients will see a therapeutic change for 3 to 6 months. When I talk about the timing for what to expect, for most neuromodulators, you're going to start to see a true set-in, around 7 days. The full outcome, I usually don't say is there until 10 to 14 days. Some patients that have been doing this for a long time feel like they're seeing the effects at 4 and they feel pretty complete at 7 days. But for any new treatment patient, I usually say wait until 14 days to see what you have. At that time, you're going to be pretty set with your hold. And then over the next several months, you will have a good duration. And then you're going to start to see, like you're seeing movement. For me, it's not completely worn off, and you're still not contributing to the development of fine lines and wrinkles when you're moving this amount, but you're going to start to see movement somewhere around 3 months, most likely. And then how long you take in between treatments is going to somewhat be up to your budget and your preference. But the idea is that we get into a cadence where you're not going so long that you're starting to contribute, the muscles are starting to truly etch out those fine lines and wrinkles again. Again, I said, Daxxify is a little different because it starts to set in about 24 hours. So that's nice for patients that forget to schedule with me and then they're like, oh my gosh, I'm leaving for vacation in a week and I need this to set in. So Daxxify is great for that because it sets in faster. And it does last in most of my patients longer as long as you're being dose treated appropriately. That's for another day, but in general, that's what you can think of when you can kind of compare the timing for these medications. That brings us into discussing what can you do to improve your overall Botox experience and outcome. The most common side effect, if you will, that we see that we want to avoid is what we call bee sting bruising that occurs from the uniquely teeny tiny tuberculin needle that we use in our office. While most people can cover this up acceptably with makeup, I do have some patients that want to do everything they can to avoid any signs of treatment. These will most commonly occur in areas where there are fragile vessels, such as in the eye area, and you have especially thin skin. This is especially true for patients that are a little bit older. So in those cases, I usually recommend that you avoid alcohol for 1 to 2 nights prior to your procedure. You certainly can extend that to the night of your procedure if you would like. I also recommend that patients avoid medications called NSAIDs. These include aspirin, ibuprofen or Advil, naproxen or Aleve, and other medications like that, as long as it's safe to do so from your medical standpoint, from your medical doctor's standpoint. Other things I recommend for anybody doing an injectable treatment, whether that's Botox or Botox with filler or filler alone, is seeking a medication called arnica. Arnica is a natural herb extract that reduces bruising. You can get this topically or you can get this orally online. There is a combination medication I really like that's called Arnica Forte that includes something called bromelain. This is an extract from pineapple that also reduces bruising, which is really effective, especially in patients that are doing filler at the same time. I always recommend, especially in filler patients, but also in Botox patients, if they want to avoid any signs of bruising, to take this for 1 to 2 days before their treatment. If they're having the lips treated, again, this is not exactly in the Botox subject line, but if you're having lip filler, I usually recommend to continue that along for a couple of days as well, but absolutely not necessary for a Botox solo first-time treatment. It's just something to make the experience even better. The other things to keep in mind to consider for side effects are facial asymmetry. So whenever we treat with a neurotoxin, we are trying to treat symmetrically. We're trying to maintain what you came in with, and sometimes trying to treat a little bit of asymmetry in itself. You can have asymmetry of the brow height and the eyelid height at baseline, but certainly when you are considering asymmetry in the muscle strength, you may look very symmetric and then be treated anyway with the same dosage on both sides and just find that one muscle pulls harder than the other, and that's treatable. Again, I usually recommend, if there's any concerns with minor differences, to come in around 10 to 14 days for most neuromodulators, and we can treat that and improve that. So that's something to keep in mind, and there's not a ton that you can do for that. The only thing I strongly recommend for post Botox or any other neuromodulator is you want to avoid pressing down on the face. There's something called Botox migration, which I've never really seen, but I do have colleagues I very much respect that have seen that in certain instances. It's been published on that if you avoid any kind of pushing on the face for 30 minutes, that Botox or neuromodulator is usually pretty much in place. However, I usually recommend against a massage where you're laying on your face or working out, give it for at least 2 hours where you're not laying on your face. When you talk about working out at the gym, I usually do not have a strong preference when it's just Botox as far as preventing infection. These needles that we use are very small, and I've never seen an infection. It's really not a concern. And so that's why I usually recommend, hey, if you need to get your workout in later on, within reason, please go ahead. And again, makeup is completely fine after a Botox treatment. So those are the main things to consider. One thing I always let patients know, because I would hate for it to be a surprise, is 1 in 100 patients will have an anatomic variation in the area of their eye, in the muscle called the orbicularis oculi, where they have what we call a dehiscence or an opening there, right at the kind of the head of the brow. And this can cause, or it's the most common cause of something we call eyelid ptosis, where one eyelid may drop because the function of the levator muscle in the eyelid that usually holds the eyelid up can be affected by the Botox if it migrates down during the glabellar treatment. So there is a muscle here that causes those 11s. It's called the corrugator. There's different kind of depths, and as it comes in toward the nose, it goes a little bit deeper. And so if we get too deep in the injection of the Botox or neuromodulator in that area, and your patient ends up having that dehiscence, and we end up pushing on that to push, and it ends up pushing down into the kind of the eyelid area, then you start to increase that risk, and that 1 in 100 patient with that anatomy can experience some of that eyelid ptosis. The good thing to know, and the reason why you should call your provider, is that it is treatable. And it's nice to know that while I don't minimize what a nuisance and inconvenience this is and how this can be embarrassing for patients, it only usually lasts around 2 weeks when you're using a regular neuromodulator, such as those that I've spoken about, even though the usual therapeutic range is 3 to 6 months with the neuromodulators. And the rest of the face, for whatever reason, it gets moved out faster, likely because you're using that muscle a ton, and so that's one of the reasons that they get metabolized faster. Is any muscle that you're using more, it moves on faster. So it's always good to know those things. Is that something that we should be a primary worry about? Absolutely not. From the patient's perspective, it's always something as a provider and as a physician that I'm thinking about to avoid. But there's really nothing that you can do as a patient to completely affect that. Otherwise, the next most important question for most patients is cost. I always tell patients, you're going to get what you pay for, just like anything else in life. Sometimes we've started to think about Botox as an easy in, easy out. And the nuance of that is that the facial structure is very complex. And if you happen to have a asymmetric face, or that that just different muscle pulling, or you start with asymmetry in the brow, or you have baseline asymmetry of the eyelid margins. These are things that you really want to make sure that you're working with an expert and somebody that you trust. And so if you are getting $8 per unit or $9 per unit or even $10 per unit, you want to wonder, what is the experience of that person that is providing you near at cost or rushed treatment? And if you have low to no tolerance for prolonged facial asymmetry, then I highly recommend that you look for somebody with experience. And then this prolonged answer of what is the budget? So most of my patients will end up being somewhere between $500 to $750. Usually the $500 is a middle-aged female with regular needs, whereas the $750 to $800 patient is usually more of a male with stronger brow muscles or frontalis muscles with a larger forehead. Males, just like everywhere else in the body, tend to have stronger muscles, so they need to be treated with a higher dosage. You'll also have some other increases to that episodic cost if you're doing something like a lip flip or you're treating other areas. But I usually tell patients that anywhere from $1,500 to $2,500 in the Midwest, where we are, is a completely appropriate investment in your Botox regime. Things that you can do to extend the value of that, which we can talk about in other videos, would be absolute high-end skincare and sticking with the routine. Because as I mentioned before, there's a bell curve of when you start to notice facial movement. And usually you will delay noticing that facial movement if you're well hydrated and you're taking care of the quality of your skin. You're not noticing intrinsic thinning of that skin. That all combats the appearance of fine lines and wrinkles. And so you're just not going to notice where you're starting to move more until later. So these are all things to consider in maintaining your sense of vitality and confidence. I hope this was helpful, and stay tuned. Always subscribe for more educational information. Thanks for tuning in. Bye.